Bonjour! At the Healthy Frenchies, we are here to help you better understand the backstage of healthcare in Singapore. No matter if you are a young graduate starting your professional life, a young couple planning having a baby, or a big family, if you want to live in Asia, you will definitely consider Singapore as a place to live. According to a lot of surveys, it is one of the best countries to live as an expat. Quality of life, food, multicultural, security, education, and most of all, healthcare system. But it is also one of the most expensive cities in the region. So while you will plan your arrival to Singapore, the first thing you will need to consider is budget. For sure, we all think first of the place where to live, a premium condo with all great facilities like barbecue, swimming pool, tennis court. Schools for the family are also really expensive. But will you take so much time to check the healthcare cost and see how to protect yourself the best way? Depending on your personal situation, you need to consider what you will cover with health insurance and what you are ready to pay out of your pocket. For a young graduate who is starting his professional life, it is clear that your priority would be covering the big risk, which is, wait for it, hospitalization. This is the only good advice we can give you. You do not want to have your family contracting a debt because you had a surgery at Raffles Hospital. For the other medical costs, like GP consultation, physiotherapist, specialist consultation like gynecologist for women, except if you have a particular health issue, you could consider evaluating a budget aside and use it only if you need it. This budget could be optimized if you follow simple rules. Go to public healthcare system. Trust them, they are really great professionals. Do not go to a private clinic if you have a flu. You will pay $100 compared to $30 to a local general practitioner. For a couple of plans to start a family in Singapore, we already talked about it in a former episode. Maternity cost could be the biggest budget. You have two options. One, an health insurance only covering complications for the pregnancy and the delivery. Two, get covered for almost everything. For the first case, it will mean that you will need to anticipate and to secure every cost. The choice of your doctors, the hospital where the delivery will take place, be ready to negotiate. It might seem weird to some expats, but negotiation of the hospitalization cost is part of the process in Singapore. And then comes the big families. You multiply everything by 3, 4, 5, 6, whatever. So for sure you will check the healthcare cost before moving to Singapore. Problem is that it is always more difficult to be rational when it is about your own children. So instead of advice, I will tell you what you should not do. First, do not listen too much to other expats, as their financial and personal situation could be very different than yours. And health is very personal. Second, do not go always to private hospital. Anticipate and choose which hospital you want to go to in case of any medical situation. Third, do not consider that vaccines should be mandatory in the health insurance cover of your children because you will pay almost the same price in the insurance cost as if you were paying directly the clinic. Last one, do not underestimate the cultural gap while talking to a doctor in Singapore. He might tell you that your son has a huge head and make you do many MRI while you just realize that it's just a family thing. That's a true story. So don't worry, be happy, and may the health be with you.